6:52. Welcome back here this morning. We are talking your health this morning. We got Dr. Joseph Webster joining us this morning with the Webster Surgical Center. Good morning.
Good morning.
You know, this morning we're talking about gastrointestinal issues, and look, there's so many different things that could be, impacting our insides, and there's things that we may be doing kind of day in and day out, not even realize it, that can kind of have different impacts. How important is just kind of lifestyle choices and or lack thereof impact kind of our bodies?
Very important. I have a rule called the 40-40 rule, that what we do the first 40 years of our life dictates what we do the last 40 years. And so the intake, our choices about food choices, how we eat, how much we exercise, all of those things are particularly important in every phase of our lives, and obesity being a main pandemic in the world today. So it's very important. Things that we can choose and control, we should do that.
You mentioned that 40-40 rule. Is it ever too late to change?
Some things, no, but most things, yes. Some things that after 40 you cannot do much about, but unfortunately a lot of things you can. So it's never too late to begin to try to pick up on healthy lifestyle activities. That's important.
You were mentioning here, coming on, there's a particular bacteria. It infects about 30% of Americans, and it can cause ulcers, even lead to cancers.
That's correct. There's a bacteria called Helicobacter pylori, or H. pylori for short.
Okay.
And it's been around about 50,000 years. Actually, Napoleon probably had this bacteria. We know he died from gastric cancer. And unfortunately, one of the leading causes of gastric cancer is this particular bacteria. But fortunately, most people who have it will not get gastric cancer.
Where does it come from?
Well, it's ingested through the mouth. We do not know exactly where. We mentioned food earlier, waterborne. It follows socioeconomic distribution. Worldwide, about half the population has this bacteria. In the United States of America, about 30% of the people will have the bacteria. And it falls out based on, again, SES distribution. African Americans, 50%, Hispanic Americans, 40%, Caucasian Americans, about 20%. The good news is that most of the time it does not cause gastric cancer, very rarely, but it can. But what it can cause is what we call dyspepsia. It can lead to upset stomach, indigestion, and it promotes peptic ulcer disease. 90% of the time, a duodenal ulcer is associated with H. pylori.
You know, sometimes too, you were also mentioning, our gastrointestinal health, exercise and eating well, but, sometimes too, we hear about washing hands and things like that, because there's a lot of other bacteria and things we could be putting in our system and sometimes not even realizing it. How important is, just hand washing health, for example?
Just plain hygiene is very important. It's suspected that this particular bacterium is contracted during childhood when we play with all kinds of toys and things, and guys go out and play football and, lick their fingers to get a good grip on the ball. Well, those things are not exactly perfect hygiene. And so we do all kinds of things that put bacteria in our systems. This is just one that's pathogenic.
And at the end of the day, how do we stay safe? I mean, there seems to be so many, just billions and billions of bacteria out there. What's the best way of just staying safe and keeping a healthy gastrointestinal tract?
As relates to this particular bacteria, if there are red flags, if you are over 55, if you're losing weight, have an anemia, if you have a family member with a history of peptic ulcer or gastric cancer, then your primary care physician should test you for the bacteria. Once found, it should be treated, and then test it again to make sure you got rid of it.
You were talking about losing weight. Are there other symptoms that come along with it? Is it, maybe headaches or anything like that? I mean,
no, most of the time it'll be referred to the gastrointestinal tract. The losing weight would be a red flag. That means you really need to get some further attention.
Good advice there, Dr. Joseph Webster. Thank you very much talking your health this morning. And more tips you can, of course, find on our website, WTXL.tv. Stay with us, much more.